Hey everybody, Dr. Reed here. Just had another update. Today is Tuesday, March 17th, 2020. So I guess happy St. Patrick's Day to everybody. A few things have changed since our last update on the afternoon of Friday, March 13th. Specifically as it concerns the gathering of large groups of people. The governor of Kansas has recommended that people avoid gatherings of 50 or more people. And then just yesterday, the Johnson County Health Department, along with health departments all over the Kansas City metro, have recommended that people avoid gatherings of more than 10 people. And so in recognition of these new recommendations, Dr. Curts and I have consulted and made the difficult decision that we are going to remain closed for regular business beginning at noon today, March 17th, probably through at least the end of the month. So there are a few things that I wanted to go over just because I know that there are patients that had appointments scheduled and people who were waiting on glasses and contact lens supplies. So let's just go ahead and go over these. First of all, know that as the situation is fluid, that we are keeping up with all of the latest recommendations. And so should this change, should we be able to shorten the time frame that we have to be closed or need to lengthen the time frame that we need to be closed, we will be sure to let you know. Now, as far as exam appointments, because a routine eye exam cannot be done well in a remote setting or even with social distancing practices, we are not going to do any sort of routine eye examination from now through at least March 31st. Patients who had routine eye exams scheduled should have been contacted by now, or if not, we are in that process, and so we will contact you shortly to reschedule those for later. If you were planning on getting a routine eye exam between now and then, the best way to get in touch with us is on our website, curtsandreed.com. If you click the hours and locations up at the top of the main navigation screen, the bottom of our hours and locations page has a contact form that will get you directly into contact with either Dr. Curts or myself, and we will be able to update you with whatever the latest is at that time and get you scheduled for after March 31st to go ahead and get your routine eye exam scheduled. Patients who are already waiting on glasses or contact lens supply order, we are in touch with our distributors and our suppliers, and as those come in, as they're able, we will get in touch with you and notify you that those things are ready to be picked up. I will note that glasses and contact lens supply pickups will be by appointment only. We will reach you and you will need to get in touch with us over email to schedule those. The last thing that I wanted to say as far as scheduling goes is if you have an urgent or emergent eye need, if you scratch your eye or get something in your eye or your eye appears to be infected or inflamed or otherwise unwell, please do contact us via our website. As I've explained earlier, Dr. Curts and I will both have limited availability over the next couple of weeks for urgent and emergent eye evaluations and treatments. So that sums up the changes here at Curts and Reed. I did want to take the opportunity to reiterate the things that the CDC has recommended to reduce the spread of the coronavirus. The first and most important is to wash your hands frequently, especially before and after you use the restroom or need to eat or come into contact with other people. When you have a cough or sneeze into a disposable tissue, dispose of it and then wash your hands. Stay at least 6 to 10 feet away from other people if you have to be out. The best practice at this point in time is over the next couple of weeks for you to stay home as much as possible. And if you feel sick, by all means, it's probably just a flu or a cold, but assume that it is the coronavirus and assume that you are contagious, and please keep yourself in isolation for the 2-week recommended time frame. The last thing that I will say is that, again, if you need to get healthcare, wear a mask when you're outside. We will be asking all of our patients if they need to see us over the next 2 weeks to come in wearing a mask just to be safe. And if you are not sick, please don't hoard things like masks and hand sanitizers and sanitizing wipes and things of that nature. There are people who are sick who will need those, and it is best for everybody if they can get them when they need them. Any other questions? If you have any concerns, if you're worried about your eye health or how the coronavirus might impact your eyes, please feel free to reach out to us via our website, and we will get back to you and answer those questions as soon as we can. The last thing that I'll leave us with is an admonition. Please, everybody, be safe and be kind, and we will get through this. And we look forward to letting you know that we're open for regular business again soon.